Have you ever wondered if masturbation in your later years could actually harm or help your prostate health? It's a question that's often whispered but rarely answered with clarity. Yet, it's one of the most important topics for men over 50 who want to maintain both their vitality and their peace of mind. Today, we're going to break the silence and look at what science actually says about the role of ejaculation in keeping your prostate in check. I'm Dr. Isabel Lopez, a urologist with over 25 years of experience. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. This video isn't about taboo or judgment. It's about giving you the tools to take better care of yourself, based on facts, not myths. We'll explore how regular ejaculation, whether through intercourse or masturbation, might play a part in prostate health. There's a growing body of research suggesting that what many consider a private act might actually serve a very public purpose, the long-term protection of your reproductive system. We're not just talking about sexual function. We're diving into inflammation, cellular turnover, and the natural mechanisms your body uses to keep itself clean and functioning. You'll learn why doctors like myself are increasingly open about discussing sexual habits with older patients. Because the more we understand about the physiology behind ejaculation, the more we can use that knowledge to reduce risks and improve quality of life. That's what this conversation is really about, empowerment through science. This is especially important if you're already facing urinary symptoms or just want to age with more confidence and control over your body. The answer to your health might not be in a new pill, but in a habit you've had all along. To understand the connection between masturbation and prostate health, we first need to look at what the prostate actually does. This small, walnut-sized gland sits just below the bladder and plays a vital role in male reproductive function. Its main job? Producing a significant portion of the fluid that makes up semen, specifically the part that nourishes and protects sperm as they travel. During ejaculation, the muscles of the prostate contract forcefully to expel this fluid through the urethra. This isn't just a mechanical process, it's a biological cleansing cycle. With each ejaculation, the gland releases built-up secretions that could otherwise accumulate and create an environment ripe for inflammation or infection. When this fluid is stored for long periods without being released, it may lead to congestion within the prostate. Think of it like a filter that never gets flushed. Over time, stagnant fluids can contribute to discomfort, inflammation, and even long-term changes in the prostate tissue. Regular emptying helps maintain the gland's internal balance. This is why some urologists consider ejaculation, whether through intercourse or masturbation, a potential maintenance tool for the prostate. It's not a magic bullet, of course, but understanding this mechanism gives us a clue as to how simple, natural functions can support internal health. It's also important to note that this isn't about performance, it's about biology. Even in the absence of a sexual partner, maintaining this function can be a strategic part of aging well. The goal is to keep the system moving and prevent unnecessary blockages or stress on the gland. Now that we've covered the prostate's role in ejaculation, things are about to get even more interesting. Because in the next segment, you'll discover how something as simple as masturbation might be a powerful preventive measure. Before we dive in, I want to share something special with you. I've created a 21-day challenge designed to help reduce and prevent prostate enlargement with simple exercises you can do in less than 15 minutes a day. Don't wait, grab your copy of the ebook right now. The link is pinned at the very top of the comments. Now let's talk prevention. Several large-scale studies, including one published in the Journal of the American Medical Association, have shown a fascinating link. Men who ejaculate more frequently tend to have a lower risk of developing prostate cancer. Researchers suggest that regular ejaculation may help flush out potentially harmful substances before they become a problem. This cleansing effect supports a healthier internal environment, reducing the chance of chronic inflammation, a known contributor to prostate enlargement and malignancy. By keeping the ducts and glands active and free-flowing, ejaculation may reduce cellular stress and support more stable tissue function over time. Stick with me until the end, because what I'm about to share might truly change your life. And don't forget, I've got a surprise waiting for you at the very end of this video. But it's not just about avoiding disease. Ejaculating regularly can also promote hormone balance, specifically testosterone and DHT, which are closely tied to prostate size. When managed naturally, these hormones support reproductive health without placing unnecessary pressure on the prostate. It's essential to recognize that prevention doesn't require extremes. We're not talking about high frequency or setting goals. What matters is consistency, a regular rhythm that keeps your reproductive system functioning smoothly, just like any other part of your body. Next, we'll talk about a crucial distinction: why masturbation isn't a cure, but how it might still help men who are already experiencing prostate enlargement. Let's be clear, masturbation is not a cure for an already enlarged prostate. Benign prostatic hyperplasia, or BPH, is a structural change in the gland that develops over time, influenced by age, hormones, and genetics. Once the tissue expands significantly, it often requires targeted treatment. However, that doesn't mean masturbation is irrelevant in this scenario. For men with mild symptoms, like occasional urgency, nighttime urination, or difficulty starting the stream, regular ejaculation may offer some relief. The act stimulates the pelvic muscles, promotes better drainage, and reduces internal congestion that can worsen discomfort. Think of it as a way to gently release the pressure inside. It's also worth noting that during ejaculation, the prostate contracts, helping to push out fluid that may otherwise linger and create irritation. This natural cycle supports a healthier glandular rhythm, especially in men who aren't yet candidates for medication or surgery but want to slow the progression of symptoms. While this isn't a substitute for medical follow-up, some patients report feeling less tension and greater ease after a period of regular sexual activity. It becomes part of a broader lifestyle strategy, alongside hydration, diet, and movement, that promotes urological health in a non-invasive way. Of course, if the prostate is already severely enlarged, the impact of ejaculation on symptom relief is minimal. At that point, the physical space the gland occupies becomes the bigger issue, and interventions like alpha blockers or even surgery might be necessary. But for those in the earlier stages, the role of self-care remains powerful. Next, we'll look at the unexpected side benefits of masturbation that go far beyond the prostate, and how they influence your overall well-being. When we talk about masturbation and prostate health, it's easy to focus solely on the gland. But the truth is, regular ejaculation can benefit the body in ways that ripple far beyond the prostate. One of the most overlooked advantages is improved pelvic blood circulation. Every contraction involved in sexual release helps stimulate flow to areas that often suffer from stagnation as we age. This increase in circulation supports tissue health, delivers more oxygen, and aids in the removal of metabolic waste. It's a kind of gentle, natural massage that keeps the lower pelvic area functioning optimally. For men over 50, this can help maintain not just urinary function, but also erectile strength and sexual response. Another key benefit lies in stress reduction. Ejaculation triggers the release of endorphins and oxytocin, hormones that naturally elevate mood and promote relaxation. In a world where stress is one of the biggest drivers of chronic disease, this hormonal release becomes more than just pleasurable. It's therapeutic, helping to regulate the nervous system and improve sleep quality. There's also evidence that consistent sexual activity contributes to better hormone regulation. Testosterone, which declines with age, may be better balanced through regular use of the sexual system. This doesn't mean it prevents aging, but it does support a more stable, energized hormonal environment, critical for physical and emotional vitality. Emotionally, masturbation helps many men maintain a sense of autonomy and connection with their own bodies. It can boost confidence, reduce anxiety, and strengthen the relationship with one's own health. This becomes especially meaningful for those who are single, widowed, or experiencing changes in sexual partnerships. Coming up next is our final takeaway, and if you've been watching closely, you know what's coming. Join the Members Club. Drop a super like, follow the channel, and leave a comment. Let's wrap this up with clarity and purpose. Masturbation, often misunderstood or dismissed, emerges here not as a vice, but as a potential ally in your journey toward better prostate health. For men in their 50s, 60s, and beyond, the act of regular ejaculation can serve both as a preventive measure and a source of physiological balance. It's not a cure-all, but it plays a valuable role in keeping the internal systems clear, active, and responsive. The prostate isn't just a passive gland. It responds dynamically to how it's used. And when it's engaged through consistent, natural function, the benefits can extend from reduced inflammation to improved hormone regulation. These aren't just theories. They are grounded in credible studies and clinical observation. But here's the key. Masturbation is most powerful when integrated into a larger framework of health. Think hydration, anti-inflammatory foods, stress management, and movement. Together, these form a strategy that supports your body's design rather than working against it. This is proactive aging, rooted in science and simplicity. Of course, no self-care practice replaces professional guidance. If you're experiencing persistent symptoms, frequent urination, pain, interrupted flow, it's time to talk to a urologist. There are many tools available, and early action leads to better outcomes. Masturbation may help, but it works best alongside medical insight. So, the next time you ask yourself whether masturbation could be harmful to your prostate, remember this: it might be one of the easiest steps you can take to stay healthy, active, and in control of your body. Embrace it with understanding, not shame, and use the knowledge to make smarter decisions. Join the Members Club, drop a super like, follow the channel, and leave a comment. Let us know your thoughts or questions. And if you haven't grabbed your copy of the 21-Day Prostate Health Challenge, it's still waiting for you at the top of the comments. Take care of your health. It's the most powerful investment you can make.